Good morning, everyone. My name is Rachel Kellogg. I work in the Office of the Assistant Secretary for Health at the Department of Health and Human Services. Thank you so much for joining us today, and thank you for all of the work you're doing in your individual states to protect our most vulnerable communities from COVID-19. The purpose of this webinar is to assist states in their continued outreach with nursing homes and to allow BD and Quidel to walk through their training programs that are being utilized by the nursing homes. Each manufacturer will present for 20 minutes, followed directly by a Q&A. We will also have a presentation from CMS at the end to discuss the nursing home testing rules mandate. After the webinar, we will send out slides presented during today's presentations, as well as a recording of the webinar, because I know a lot of states and individuals were not able to join today. I would also like to note this call is not intended for media. Can we go to the next slide? If you would like to submit a question, please submit it through the Zoom Q&A chat box. Unfortunately, given the amount of participants we have, we figured it would be easier for people to submit their questions through this chat box, and we'll do a moderated Q&A. If there are questions that we don't get to, we are going to capture those, and we're going to send out a follow-up email to all of the registrants to respond to the questions that we are not able to get to live during today's webinar. And today's speakers, we will have Allison Leon and Cheryl Miller from Quidel to go through their training program, Lucy Turlin, Courtney Jackson, and David Barrett from BD to go through their training program, as well as Jean Moody Williams to go through the nursing home testing rules mandate from CMS. And like I said earlier, we'll have a Q&A portion after each presentation. So if you have specific questions for Quidel, you'll ask them right after their presentation. For BD, you'll ask them right after their presentation. And for CMS, you'll ask right after Jean's presentation. And with that, I will turn it over to Allison and Cheryl from Quidel to begin their training portion.
Thank you, Rachel. Hopefully you can all see my screen. We want to take this opportunity to share with you our training initiatives for all of those assisted nursing homes who have received a Quidel Sophia 2. The Together Again initiative is what we're calling it at Quidel. That's an important step at reuniting our residents with their loved ones. And today what we want to do is share with you our Sophia 2 training on how to run a SARS test, how to process batch tests or multiple patients at one time. We'll talk about maintenance, connectivity issues, how to extract patient data from the system, as well as reordering steps. And we'll conclude our brief training presentation with a demonstration of our website that we call QuidelTogetherAgain.com. So as a little background, we just wanted to let you know who we are quickly. Quidel was established about 50 years ago. We've got experience in multiple technologies from women's health, cardiac, toxicology, and of course, respiratory diagnostics. More recently, on March 4th of this year, we were part of the White House task force that was asked to work on COVID testing. And about 2 weeks later, we received our first EUA on our Lyra molecular assay, and then we received our second EUA on May 8th for the Sophia antigen test that we're going to talk about today. Again, as you all know, BD and Quidel are working with HHS in supporting and sending out these units to the nursing homes. So let's get started. What we wanted to do before we jumped into the instrument was talk a little bit about some of the challenges that nursing homes are seeing and that we completely understand. Now, these are individuals that maybe aren't laboratorians, so they're going to have new experiences. They're going to want to know how to run instruments and how to do patient samples and how do I run multiple patients. They may have a little apprehension and fear in being asked to do this testing. So our goal is really to help them and train them and build their confidence by going to QuidelTogetherAgain.com, because we all know that good training is going to result in good resulting. And so the program we set up has a number of components to it. So at QuidelTogetherAgain.com, you can go online. We have a self-paced learning module that they can go in and learn on their own. We also have a remote live demonstration that they can sign up for on each Tuesday and Thursday at noon Eastern time. We have a field application specialist who will walk them through how to use the system. We also, of course, will have live on-site schedules as needed if they want us to come into their facility. And of course, we'll have all printed materials available to them, not only on the website, but on the quidel.com website as well. But most importantly, what we're doing through our training plans is we're measuring who is being trained and who has received a certificate of training. HHS has asked that at least one individual from each facility completes the training certification. So how it works is like this. When a customer gets notice from HHS that an instrument's arriving, we will then send an email confirmation directing that customer to quideltogetheragain.com. They receive their instrument, and in their shipment, there will be an instruction card with a QR code, again directing them to quideltogetheragain.com. Then they're going to sign on for that online module where they can do their self-instructed training and then sign up for a virtual live demonstration. After training's completed, we ask them to take a quiz and complete the documentation showing that they are training certified. At that point in time, they are ready to begin running patient tests. So it's as easy as going to the website, completing your online training, attending a virtual training, and then getting certified. So now let's talk a little bit about what we're training for. As we all know, this is an antigen test, and we're testing for that nucleocapsid protein that's detected in the nasal passage during the acute phase of infection. We also know that the instrument has some really excellent performance at 96.7% sensitivity and 100% specificity from 5 days from symptom onset. There are guidelines from the FDA on their FAQs about asymptomatic patients, and the CDC has published considerations for interpreting antigen test results for nursing homes this August 27th. And I'm sure we'll answer additional questions later on that. So we look at your Sophia 2. When you receive the instrument, you're going to have also kits. In each of these kits, you'll have 25 tests. The tests are kept at room storage, and everything you need is inside these kits, from the cassette to your QC, to your pipettes, and your reagents. You're also going to receive a foil pouch that includes a calibration cassette, and we'll talk about calibration in a minute. Now, in a few weeks from now, the facilities will also receive another package. That package is going to have plastic tubes sent to them along with a brand new batch processing protocol. Allison is going to go through that protocol in a couple moments. But just to confirm, again, the reagents are kept at room temperature, and there's about a 12-month expiration on those reagents. So when they receive the instrument, it's super simple. On the front, there's a touch screen, a barcode scanner, a cassette drawer. On the back, they just plug it in with a power port, turn the power on, and then they also have 2 USB ports that we'll talk about in a moment. Those are ports that you can set up to download your patient results onto the USB drive. And there's also an RJ45 port in case one of the facilities would like to connect into their local area network. Again, we can have more information on that at quidel.com. When you power up, yeah.
Hey, would you mind, on the display settings, would you mind, I think maybe you're duplicating it on your multiple screens. If there's a way to magnify the current screen the current slide that we're working off of?
Oh, I have it full screen on my computer right now. It's not full screen for you?
No, it's not. No, there we go.
All right, I was in slide mode. I will take it out of slide mode, or there we go. How's that? Sorry, okay.
That's okay, thank you so much.
Sure, no problem. All right, so you're going to go through the, enter the zip code. The zip code will tell Verena, which is our wireless de-identified system, where the instrument is located so we can aggregate data and provide to you near real-time testing information on where either influenza is or the SARS-CoV-2 is happening in your local community. So once you turn it on, you enter that zip code, it's going to prompt you to run a calibration. All you do is enter your user ID, hit run calibration, insert the cassette, and in about 10 seconds, you will have calibration. You're going to get a big check mark like this as you see it happening. Now, calibration is important for a couple of reasons. It makes sure that the instrument is always operating within its performance and optics guidelines. And what it does for us, it's just like if you buy anything, things can drift or get dull over time. But calibration confirms that that first test you ran is the same as that 5,000 tests you've run years later. So calibration is a key feature on the system that we're really very proud of. The next thing you'll do is run controls. And again, based on time today, we're not going to get into how to run controls, but it's just like a patient result, which we will follow through. On it, we do have the ability to go to Quidel Quick Start to see videos on how to run QC, and also there's documentation if you'd like to read about how to run QC as well. We follow standard control guidelines like other CLIA waves assays, where we ask that each untrained operator runs a control. You run controls for new shipments or new lot numbers, and of course, based on your state laws. Now the good part, how to run a patient. So in your kit, as I said earlier, you're going to receive the reagent tube. It looks like that little glass tube you see on the second number there. And you're going to have a little saline. It looks like an eyedropper. You're going to put that saline solution into the reagent tube because there's going to be a pellet. It's a lyophilized reagent that we're just hydrating. And we do that just for shipping, so it stays nice and stable. You insert the patient swab and you swirl it and let it sit for 1 minute. Now this is pretty standard across all tests out there, is that you want to be able to let that swab get disrupted in the reagent so we can go in and look at that nuclear protein that we're measuring for. After a minute, you remove the swab. Section 4 is just showing you wring it out just to get as much fluid as you can off of the swab. You then use your disposable pipette that comes in the kit, squeeze the top bulb and aspirate that sample, and you place it into the cassette well, as you can see in number 6. Okay, so at this point, once you put the sample into the well, it's going to migrate across that cassette, and it takes 15 minutes or so for it to migrate across, and that antigen is connected with antibodies that we're then going to read in the instrument. Now, there's 2 ways you can let that 15 minutes happen. You can let it happen within the instrument, which we call walkaway mode. That means you just pop it in the instrument, it will read the barcode on the cassette, know exactly what tests you're going to be running, and you can walk away and go see patients or fill out documentation and come back whenever. When you come back, those results will be saved on the Sophia 2, they'll be saved on the USB if you've configured it that way, or they'll be sent to your EMR again if you configured the instrument to run like that. Now the second option is what we call read now. And this is really a batch processing method. So again, think about if you were doing baseline testing in your home, or if you had an outbreak, you wouldn't want to wait 15 minutes in between each patient. You'd want to be able to batch those patients all at once. So how this works is, again, you would put the sample in the cassette and you'd set a timer for 15 minutes. You could then process another patient cassette, set another timer for 15 minutes. So you could have multiple cassettes on your counter at 15 minutes. When the timer goes off, you simply insert the cassette into the Sophia 2, make sure it's in that read now mode, and then the instrument will give you a result in about 20 seconds. This allows you to process up to 40 to 50 tests an hour, because now what you're doing is you're timing on the counter versus having the instrument time the cassette for you, as in walkaway mode. So it's very flexible in its operation. So at this point, Allison is going to go through some more concepts on how to batch test and some additional tools that we're developing for all of you to understand batch processing.
All right, thank you so much, Cheryl. So as Cheryl said, we're going to get into more detail around batch mode. So in a few weeks, we will be launching a document to support batch testing and how to run multiple patients at a time. And above you can see there's directions that the nursing homes will be sent as soon as they are approved. They're still going through the approval process. So what you're getting right now is a sneak peek of what's coming. So these details are extremely clear and very prescriptive so that they're able to effectively run this way. So to start, you want to make sure you have your PPE on, and then you have these dry clean special plastic storage tubes where you want to go ahead and write the patient's name on this tube. You'll ask them to blow their nose to get rid of the excess mucus, and then they'll go ahead and collect the sample. At that point, they'll put the sample in the special storage tube, and then they'll take it to where they're doing the testing. Then what they do is they go ahead and place the patient's name on the reagent tube that Cheryl talked about earlier. So now you're ready to process the sample. So as Cheryl went through the process before, you reconstitute the reagent, you put the sample in the tube, you let it sit for a minute, and then you go ahead and express as much liquid off the swab as you can, and you charge the cassette, or you dispense the sample into the cassette. It sits on the countertop for the 15 minutes, and while it's sitting there incubating, you can start your next test, so you don't have to wait the full 15 minutes. Okay, so now that the sample has processed and you're ready to go ahead and put it into the Sophia to be read, you start by entering the user ID and the patient ID, and you go ahead and press the play button. At this point, you want to make sure the Sophia is set to the read now mode. And if Verena is turned on or enabled, you want to enter the patient's name and then press the arrow to continue. Then you'll go ahead and insert the cassette into the Sophia 2, and in less than a minute, you'll have your results. Once you complete this process, you take the cassette and you discard it in your biohazard, and then you just repeat with the next cassette. It's basically the same as before, except the cassettes incubate on the benchtop. It's really just that easy. So now let's talk a little bit about maintenance and warranty. So with maintenance, you just have to, you can clean the Sophia 2 with a soft cloth using 70% alcohol. You do not want to use any other kind of soaps or solutions because it's not recommended. You may also wipe the cassette drawer, and you can take that out and wipe the entire cassette, the entire drawer. Now with warranty, you can go ahead and submit your Sophia to Quidel if you have any issues with the system. Please don't attempt to do any maintenance on the system with the exception of cleaning and replacing the battery. Now let's talk about connectivity and reporting. So the Sophia 2 has two different sets of data that it can process. The first set is the identified data that's sent through the Verena system, and this is included with your system. De-identified data is automatically transmitted to a cloud that allows you to compile, analyze, and generate reports from across your entire system. You'll also be part of a community of Sophias. So all Sophias that are connected to the Verena, you'll be able to see their data, and you'll be able to look directly into your local community to determine disease prevalence near real time. I can't spend a lot of time on this today just because we have to consider we only have a few more minutes here to go. So in addition to the Verena, the Sophia 2 can send identified data through the middleware that will connect to the EMR system. And next, let's talk a little more about reporting options. So you can report in four different ways. Number one is manually. You can go ahead and copy the information on the screen onto your patient log. And then the system will also store up to 1,000 results at a time. Then you have a USB, and as long as it's configured appropriately, you can put that in the system, and you can ask the system to download all results to the USB stick, and then you can go ahead and pull those data into a CSV file and look at your information. Another way to do it is printing, and you're able to print using a Dymo printer. And then as Cheryl talked about before, we can interface with the EMR LIMS system so that the results are automatically transmitted. Okay, now this is the fun stuff. Let's talk about QuidelTogetherAgain.com. This is the site that we created specifically for the HHS initiative. So this is the landing page, and in the center of the page here, you can see there's a Learn More button. When you click on the Learn More button, it takes you to a menu selection. And there are 4 options you can see here: training, required certification, order more tests, and get support. We're going to go over all 4 pieces, starting with training. So we have a multifaceted training program that we reviewed earlier. We have online video modules, print links, and live virtual trainings. These are all accessible on this page. You can see the online training modules in the center of the page, and on the left navigation, you have access to resources supporting the HHS program. Okay, next we're going to go ahead and look at virtual training. So when you go into virtual training, we have trainings every week on Tuesdays and Thursdays at 12 p.m. Eastern Standard Time. You just register for the day that suits your needs and attend the training. And then at that point, you want to go ahead and click to go back to the top of the page, and you come back to the menu selection. And at that point, you can click on Get Certified. So you click on the second orange button there, and you come into this page where you can access your quiz, which you want to take a quiz, and then you can go in and get your certificate of training when you've completed all of these steps. Now, let's talk about how to get more tests. So when you go into the website, you can go and see that to order more tests, we're utilizing McKesson and Medline to provide these tests. And you can see there how to order either by phone or by email. It's very simple. And then when we go into our support team, which is really a top-notch support team, excellent customer service from them, and they have a lot of information that they can help you with. Whether you have a problem or you just have a question you want to inquiry, go ahead and give them a call. They're always there to help. So and then the next page, it brings us back to the landing page again. And so this is, the initiative that we put together. This website hopefully will really support the nursing homes today and in the future. So let's talk a little bit about ordering more tests, just because it's important. So when your nursing homes are ready to order more tests, they need to look and see their run rate and understand how many tests they're running, and then order appropriately. And again, order through your distributors, through McKesson and Medline. And if you want to grow the menu, or if they want to run flu testing as well, they can go ahead and order that too. So you can see the menu of assays that we have available, and they can grow their menu if they deem it appropriate. So that's it for today. I wanted to thank you so much for the time, and I'm going to turn it back to Cheryl.
Thank you, Allison. Again, thanks everybody, and we welcome questions.
Thank you so much, Allison and Cheryl. That was great. So we have a few questions that have come into the Q&A box. And again, if we do not get to those questions that you submitted in the Q&A box, we will make sure that we answer them and send them out to the group after today's webinar. So the first question is regarding the link, how you link the cassette to the patient. And in states that use QRP codes to send data to public health, how can one do that?
The question is, how do you send information to state public health and report? Is that the question?
Yes, and how you link the cassette to the patient.
Okay. The cassette, if we look at the batch processing, you can have the ID of the cassette go from the plastic tube to the reagent tube. On the cassette, you can write with a Sharpie if you want to keep those cassettes clear. You just want to make sure you don't write where the barcode is on those cassettes, or a lot of people will just set the cassette on top of paperwork with that patient's ID on it until they're ready to process it in the device. When you place it in the device, you can then put that patient ID in the device, so then it's tied to the result when you want to retrieve those results through either the USB or the instrument themselves.
Okay, great, thank you. Our next question is asking about refrigeration of samples. So they're asking, do we refrigerate samples until we are ready to do batch processing?
You can place those samples in the plastic tubes that we'll be supplying, and those samples are fine at room temperature for 48 hours.
Wonderful. Next question, is there a maximum amount of tests before needing to get a new machine?
No, not with the Quidel instrument. There's no expiration date on this instrument.
Great. Next question, what is the maximum time a prepared cassette can sit on the bench top before being placed in the device to run the test?
Yeah, so it's always best to run the test after 15 minutes, as close as you can get to that. But there is a small window of up to 30 minutes. So if you have multiple cassettes on a desktop, if you don't get to it exactly 15 minutes, you do have a window of up to 30 minutes to run that cassette.
Great, thank you. We've received a lot of questions about specific patient IDs. Is there a specific patient ID that is on a Quidel instrument, or it just says patient ID, so to be honest, I'm not sure what the exact question is, but if there are specific patient IDs that you all work with and could address, that'd be great.
Yeah, it really depends how each of the facilities want to manage patient IDs in their system. They may have an ID that each patient already has, or they may want to assign an ID through their EMR system, or they just may want to do something as simple as a first initial, a second initial, and a birth date. It's really up to each organization what they want to use for patient ID to make sure it's clear and they understand it. We don't have any specific directions on it, but we do think it's best to enter a patient ID and then also to have operators enter their own ID when they're using a system so you know who ran that unit, that test.
Thank you so much, Allison and Cheryl. This was really great. Again, I know that we've received a lot more questions in the Q&A box, but unfortunately we do not have time to get to all of them, but we will address them and send it out to the group after today's webinar. So with that, I'd like to turn it over to BD to go through their training program.
All right. So I am going to boot everything right back up here and introduce myself. Give me just a moment. And I'm going to share my screen. Okay, so just for a quick technical check, can everyone see my screen? That would be in actual presentation mode, or do you see it in the smaller mode again with like the...
It looks great, Courtney.
Okay, just checking because it's hard to see on the different screens. It looks like the smaller mode, which I think is what happened before. So if it's the larger mode, that's great. So quick introduction, my name is Courtney Jackson. I'm joining you today from San Diego, California, which is where BD's point of care headquarters are located. And I'm joined today by a couple of my colleagues who will join later in the call. And David Barrett is on, so he will join us as well for some of this material. So I'm really excited to walk you through the BD Veritor system. And I'm going to do things just a little differently. Obviously I have slides, but I'll be using the video a lot. And I'm going to be doing a lot of kind of live camera, webinar, fun stuff like that, just because I think there's a lot of power in showing you things live in person with the BD Veritor instrument. So first off, hopefully you guys have got your BD Veritor Plus systems. As you can see, it's a small handheld portable instrument. And what I want you to take away today throughout all of this training and all of these discussions is really the simplicity of the instrument. So harnessing the power of simplicity, right? What does that mean? We want you to take away how simple it is to use, how simple it will be to take care of the instrument, to run your SARS-CoV-2 test, to be able to do batch testing if you'd like to do that, and all those great things. So we'll be walking you through those. So again, you might want to watch the video in the sidebar. All right, so we are going to talk specifically about the system, give you more information on that. And then we'll be talking about the SARS-CoV-2 test, support enablement, walking you through the website and all those great things that you had just heard from our Quidel counterparts. And then we'll have time for Q&A. So the BD Veritor Plus system. So this BD Veritor system was launched in 2016. It's a trusted and tried true technology. It's been on the market for a while now, well known for flu A/B testing. There's other respiratory tests that can run on it too. And the original BD Veritor system was launched in 2011. So that's about 9 years on the market, providing great point of care results for flu and other respiratory testing. So as I mentioned, it is a small handheld device. The beauty, it's simple to use. We achieve fast results, right? The SARS-CoV-2, that 15-minute incubation time. It really simplifies the process of testing, which I think is very important for everyone in times of pandemic and the stress and everything that's going on, keeping it really simple and portable and able to, mobily walk around with the instrument and provide workflow efficiency. So I'll talk to you about that. If you're choosing to do one test at a time, if you're choosing to do batch testing and what that can look like. So we'll walk you through those different modes of testing. In terms of instrument use, so there is no calibration needed. The beauty of these instruments as well, although they do have a shelf life, right, which is 3,500 reads or 24 months after you turn it on, whichever come first, that was designed so there's no need for calibration, maintenance, or anything like that. So, if you have a question and you want to check if something's going on with this instrument, we have a verification cartridge that can be used so you can, insert that and check what's going on. But other than that, no calibration, no maintenance. In terms of troubleshooting, we'll always refer you to the IFU. In a rare occurrence that an error code or some type of communication code would come on the screen, we have a lot of information in our IFU, section 6.4, and it will instruct you on what to do, if that's just power cycle the instrument or whether that's call BD. So a lot of good information in that IFU. I'll always point you back to that. In terms of warranty, so this instrument is warranted for life of the instrument. Again, the whole time you'll have it, it's under warranty. So if anything goes wrong, of course, you call BD. And I do want to mention we're going to have a lot of additional trainings available to you all to spend more time to specifically walk through things. We'll do an entire training on batch flow, batch workflow testing, entire training on connectivity, so we want to spend the time to walk you through all of those things with the right experts. And today we'll just be doing that overview. Also, we've gotten some questions on decontamination. So again, like you probably heard before, if you'd like to decontaminate your instrument, the outer casing can be wiped down with a towel that's lightly moistened in either 70% isopropyl alcohol or a 10% bleach solution. So that's how you would decontaminate if that's something that you're interested in. So again, the highlights and the value drivers behind the instrument, those things to think about when you're running the BD Veritor system, the reliability, the fast results, that 15 minutes time to result for the SARS-CoV-2 test. You can use the instrument to run flu A/B, group A strep, RSV. As we move into flu season, that can become really important, being able to run more than one test at a time with an instrument. We have a similar workflow to our flu A/B assay for the SARS-CoV-2, if you're familiar with that, and we'll walk you through the workflow, again, a easy four-step process. We have automated results reporting, and we'll walk you through that in a little bit. And that means, what do you do for results reporting? And you'll have 4 different options as well on how you can take those results and, process those. BD capabilities, this is something we like to highlight, working with BD as a trusted manufacturer. You have the BD brand regarding the manufacturing capabilities, the ability to really get a lot of tests and instruments out there into the market, a strong supply chain, a broad portfolio in regards to fighting SARS-CoV-2, and of course the technical support and the training resources, which we'll walk you through. A lot of great training and competency and making sure that you feel comfortable and are competent to use the instrument. So now I'm going to be turning over the slides to David. So David, if you'd like to join, and we'll talk a little bit more about the SARS-CoV-2 test and go through that.
Thank you, Courtney. Welcome, everybody, and thank you for joining us. So what we usually do at this stage is we talk about when it's really appropriate to test for SARS-CoV-2 and the intent of an antigen test. And in order to do that, we talk just a little bit about the way the process of infection works. And you're seeing a little graphic here that shows a little single virus particle down in the lower left-hand corner, and that represents the infection of a patient. Courtney, could you please advance? And what happens is once a patient does experience an exposure, the virus is going to continue to replicate within that patient's body, pooling right in the nasopharynx. And at this point, we see a growth curve of the viral load. We refer to it as viral load that says how much virus is available there. And the first tests that came out were molecular diagnostics tests, also referred to as PCR, that actually are able to detect very, very low levels of virus because they amplify the genetic material in that virus and make it a lot easier to detect. What we're talking about here is an antigen test. And Courtney, go ahead and advance to the next curve. So what we're talking about here is an antigen test. And instead of amplifying and magnifying genetic material like a molecular test would do, an antigen test looks at what is actually available at the time the specimen is collected in order to be able to detect if a patient is positive or negative. And because of that, an antigen test requires that the patient be a little bit further on in the infection process so that that viral load is a bit higher. And we want to make sure when we start talking about antigen tests, oftentimes people get them confused with antibody tests, which this is not. Both the Quidel and the BD tests are antigen tests. That's the whole point behind this initiative, is looking for active infection. An antibody test, if you look at the curve there, antibodies will come about after an infection has occurred and will stay in place after the patient has actually recovered. So we want to be very clear, this is an antigen test that looks for active infection, and the indications for this test are for patients that are symptomatic. However, we do know that so the symptomatic window is within the first 5 days of the onset of symptoms, and we know that there are a lot of questions around asymptomatic individuals. Those asymptomatic individuals that are suspected of COVID-19 testing can be tested by their providers that Allison will be talking a little bit more about as part of this webinar. So we just want to make sure that that's clear because a lot of questions come up about that. If you could go ahead and go to the next slide, please, Courtney. So just talking a little bit about the kit, you're seeing a picture of a kit here. This is a kit for the SARS-CoV-2 antigen. It is approved under an emergency use authorization at this time. It does use the direct nasal swabs. So we'll talk a little bit more about that specimen collection. You do have a 15-minute incubation time with this, with only about 1 minute of sample prep, and a result is given within seconds. And this can be used in both CLIA moderate and CLIA waived environments under that EUA. Next slide, please. So what anybody can expect to get in a kit when they order it, you'll see a little picture of the cartridge down there in the lower left right-hand corner. They'll get 30 of those individually wrapped test cartridges. They'll get 30 pre-filled reagent tubes, 30 nasal swabs. You'll get positive and negative controls, as well as currently our package inserts are available electronically. However, this month we are expected to be putting the paper package inserts in there. Also, you'll be provided with the quick reference instructions, both for running a test as well as collecting a specimen. What is not included in the kit is the Veritor reader itself. So those are acquired separately. We do not provide the gloves. We do not provide the appropriate PPE for specimen collection. However, everything that is needed for running a test is included in the kit. Next slide, please. Talk just a little bit about the positive and negative controls that come with that. As Courtney had referred to previously, the verification cartridge that comes with a Veritor reader is used the first time the reader is set up, so that effectively ensures that everything is working properly. But with each kit, you'll have a set of controls, and those are run for each time a new lot is in place. So if somebody receives a shipment of 50 kits and they're all the same lot, the controls should only need to be run one time for that lot. Also, the controls are usually used for new operators who are being trained on the systems. Instead of doing competency training with patient samples, they may do the competency training with a control swab. And then, of course, any other internal quality control procedures or governmental regulations, they may use the controls for that as well. So just showing how simple it is to run a test. Again, everything is about simplicity with this system, as you can see with the picture of the reader there itself and what Courtney showed you. Very simple one-button operation. And what you're going to do is the patient sample is collected. It is important to know that this is a dual nares collection. So both nostrils will need to have the swab inserted in the specimen collected that way. There is only one reagent tube. It's a plastic tube that's going to have the cap removed. The swab is going to be inserted into that tube all the way down to the bottom. Swished around back and forth, up and down for about 15 seconds. And then when the swab is removed, you'll squeeze the flexible walls of that vial together as you pull the swab out. And that just ensures that all of the specimen that's in that swab is going to elute into the reagent. You'll see that you have a little dropper cap on there that's going to snap right on top of the reagent vial. It is attached to that, so you don't have to worry about losing anything. The vial will simply be inverted, and then you're going to put on 3 drops of the specimen directly from that reagent vial onto the test cartridge, incubate for 15 minutes, and then insert the cartridge into the reader to be read. Now, we do also have 2 different modes that can be used. You have what was referred to as a walk-away mode and an analyze now mode. And after this bit, Courtney will talk about the batch testing in the analyze now mode, but you have the opportunity to make a choice between how you want to run this. With the walk-away mode, you can simply insert the cartridge into the side of the reader once it's turned on, and it's in walk-away mode, and the reader will count down that 15-minute incubation step, and then it will do the read for you, and the result will be ready when you are. If you're in the Analyze Now mode, this is the one that works really well for batch testing. You simply are going to incubate the cartridge on the bench top, and then once that incubation is done, the cartridge can be popped right into the side of the reader, and you'll have a result back in less than 10 seconds. With either mode, you do have the ability to capture patient and operator information. We'll talk a little bit more about a barcode scanning module.
David, I think you're frozen.
All right, so I didn't know if it was just me. David's frozen. Can you hear me?
Yes, we can hear you.
Okay, great. Well, I'm going to take over. I was going to take over anyways right now from David. So poor David's frozen in that lovely picture. That's all right. That happens, right? So as David was mentioning, we have 2 different modes. We have the Analyze Now mode, which is what I'm going to talk to you about, which is what we use for batch testing. I'm going to walk you through the steps of that. It's very easy to do once you get the hang of it and once you kind of understand how you stagger testing. The other mode would be the walkaway mode, and that is where you have the instrument plugged in and you insert the test cartridge right after you inoculate it, and it will actually incubate right in the instrument for 15 minutes, and it will count down on the screen, and then it will read the result 3, 2, 1, 3 seconds, and you'll see the result. So what we're going to go back to, though, is the batching workflow, right, which is Analyze Now. So that just means you can set up these tests on your benchtop, as many as you like. I'm going to walk you through a batch of 10, which is kind of a reasonable batch to do at one time. And then you'll use the Analyze Now, which is inserting in, and you've got that about 3-second read. So in terms of batching, I like to always, point back to any sort of publication, clinical data, poster work, that's been done in the past to see how batching works, right? So we do have a nice poster that was presented at the ASM microbe meeting in 2019, which does show how to do batching. And this was with the flu A/B test at the time. There wasn't SARS-CoV-2 yet. But in regards to how to do batching for the BD Veritor system, it also walks through some other systems as well. So you can see how BD Veritor would compare to other systems. And it gives you a nice idea of how to set up batching. Now, a lot of people don't, have the time to go pull up a poster publication. So of course, BD also has created training materials. We have training materials in print, which we'll be sharing with you shortly. We have those as well in video format to really just walk you through how to do the batching. Because again, once you get it down, it will be easy and simple. It just takes a little understanding of how you put together a batch. So when we calculate batching, what we're talking about is actually the full process. And that would be from taking the nasal specimen from the patient, which as you know can take some time, right? The dual nares nasal collection, all the way through processing the samples and incubating them and then running them. So when we talk about batching, it really includes the whole process, not just reading the cartridges at the end. So when you read the cartridges, again, it takes less than 10 seconds, honestly about 3 seconds with BD Veritor. So you can imagine if you're just counting reading the cartridges, if it takes about 3 seconds, you can run a heck of a lot of cartridges in an hour, right? But that's not what we're talking about. We're talking about the whole process. So just want to make that really clear, all the way from specimen to setting up the test, incubating it, and then running it in the reader at the end with that 3 seconds. So what you do is you'll start by actually collecting all of your nasal swabs from the patients. And again, you have transport options. So if you are going to collect from a patient, you have an hour to use the swab. And that's something where, again, you can choose to use that. You can choose to transport that. If you'd like to, you can actually take the reagent vial as you're sitting next to the patient collecting the specimen. And because it's just the one step with the reagent vial, you can actually express the nasal specimen and then just recap that dropper tube, which is nice because it locks the system. Right now you have a kind of closed locked tube that you could transport that specimen around. So really that's a great workflow for you. And then say you go and collect from your different patients and you're keeping those labeled reagent tubes in this nice little rack that comes with the kit. So you could put 10 of these tubes right at one time in the rack. You've gone around, collected the specimens. Then you come back and you would actually have the specimen in there, right? And you would have done the 15-second expression of the swab, and you would have the tube capped. So at that point, this is where you set up the stagger, okay? So you would have your 10 cartridges that are out and labeled. Again, an easy way to label is with the Sharpie marker. You can do that on the base here of the test. You would also obviously have your reagent vial labeled. And then you'll simply set up those 10 cartridges on your bench top. At that point, what I like to do is I like to start a timer right when I inoculate the first cartridge, right? Because that means we're gonna have 15 minutes, right, that we need to incubate. So I'll have my timer ready and I put the 3 drops of specimen into the cartridge, put that on the bench top, start that timer, starts the counting up to 15. What I then do is just stagger. I say, I'm gonna start one test every 30 seconds. That's what works for me. And so what you can do then is you can inoculate and stagger the cartridge inoculation. Then you simply watch the timer. When it hits 15 minutes for the first test, you're able to read that test in Analyze Now mode, 3 seconds, 3, 2, 1, result. Then you would take the cartridge out, dispose of it, and move to cartridge 2. As soon as you then hit that 15 minutes, read cartridge 2. So you would repeat that through your 10 cartridges. And that's how you're going to get batching mode. So what we say, having done this and having had studies done before with this, you can run about 24 tests in an hour if you are, doing that whole workflow and batching and setting things up staggered. So again, that's the potential, including that entire workflow. So that is how we do batching. And again, more resources in print and in video for you to really to see that and to get that to sink in. It's hard on the little screen here to really see the full batching mode. Okay, so test performance. So I love talking about the clinical performance of our tests. I get really excited about the clinical EUA study that we did for this product. So again, BD, when we set out to do our clinical EUA study, we wanted to make sure that we had a very broad sampling set across the US. As you know, COVID it pops up and down in hotspots. Some hotspots have really high prevalence, others hotspots have low prevalence. So we wanted to make sure that we had a very representative set of data over 21 different geographic sites across the US. And this included things from skilled nursing facilities, tent testing, drive-through testing, very non-traditional settings, as well as traditional care settings like clinics. So again, setting that up to make sure that we really had a broad base and that we weren't just narrowing in on, say, a hotspot or an area with high prevalence that might not be representative across the US. So in terms of that performance, we had 84% positive agreement with our molecular reference method, and we had 100% negative agreement with that molecular reference method. We also made sure there was no cross-reactivity with other human coronaviruses that cause things like the common cold or other respiratory illnesses that are important that could potentially be in someone's specimen. So we get a lot of questions about what does that PPA, right, that positive percent agreement and negative percent agreement really look like out there in the real world when you're at, say, a 10% prevalence for SARS-CoV-2, which is about the national average right now. So in terms of calculating the positive and negative predictive value, I think it's helpful to look at what the real world performance might be in a test like this, right? And again, this is an antigen test. This detects protein. That's always important to remember. This is not a molecular test, right? The rapid antigen tests detect protein, which there are advantages to that, right? We're seeing studies and seeing data coming in, what actually reflects the actual true virulence in a patient. When does that virus die off? When does it go away? Molecular tests can keep detecting RNA and nucleic acid far long after a virus may still be infectious, right? That's where you do viral culture to really understand that. So it's great to see those viral culture studies coming out. So back to antigen testing. So in terms of the negative predictive value, we have over 98% negative predictive value at that 10% COVID prevalence and over 99% positive predictive value at that COVID prevalence of 10%. So that means that it means that actually fewer than 2% out of 1,000 people might receive a false negative, and fewer than 1% out of 1,000 people might receive a false positive. So something to keep in mind when you're looking at, what does positive predictive value, negative predictive value look like out there in a real world scenario? So at this point, I want to pivot a bit and just walk you through some of those features, in terms of how do you trace the data? What does data traceability look like? Are you going to be using the barcode scanning feature on the instrument? Are you going to be doing any other way of, say, printing or downloading the data? And just to walk you through what some of these things look like, because, different customers can use different methods here. So in terms of the analyzer, the base analyzer does not come with a barcode scanner. And again, that's giving customers the choice of if they want to have a barcode scanner, if they want to use barcode scanning. So if your facility will be using barcode scanning, say you have barcodes set up for patient ID, patient accessioning, say you have a barcode for your operator, the person who's running the test on their, employee badge, you want to scan in kit information, whatever. So there is the info scan, which is the barcode module. And I'll show you here, it's really simple. The instrument, again, would have a normal plastic faceplate here. If you want to use the info scan, you will order that through your distributor, and then that simply pops into the front of the instrument, and that enables barcode scanning. So you can see it's built in and it's easy to use in terms of scanning. You would be able to scan in those things such as specimen ID, operator ID, kit lot information, and this gives you an option for data traceability to link that patient ID directly to that result. And what do you do with the result? Well, obviously it appears on the screen as soon as the test is done running, and then you have 4 different options, right? So the first option would be to manually transcribe the result. So you'll see SARS-CoV pos, neg, and you could then obviously manually transcribe that onto your data record sheet. However, there are other options too. So I'll walk you through what those look like. So you can choose to download the data, and again, this is through USB. So the instrument has a nice micro USB port here on the back, and it comes with a nice data download cable. So that's something that you can use to connect the instrument directly to a PC through the USB port. So you have that option, right, of downloading your data to your PC. You also have the option of printing. So in terms of printing, we have several nice little small handy dandy receipt-like printers that actually print the result stat as soon as the result is complete. So you could choose to print. The fourth option would be connectivity. So if you would like to connect into an LIS, an EMR, an electronic medical record system, we have that as well through the BD Synapsys system. So I'll just briefly touch on that. I know we'll have a whole nother training on that for those of you who are interested in talking more. But I just wanted to let you know again, you do have those 4 options for data traceability and for helping with that data reporting. So as I mentioned, we do have the BD Synapsys system. Make sure this pulls up on the screen here. There it is. All right, so in terms of connectivity, you have the ability to connect to the instrument. There's different mechanisms of connectivity. We can talk to you about, if you're interested in something cellular, you're interested in something Ethernet, or what method of connectivity to actually connect the system into your LIS EMR. So again, we have that capability and are happy to walk you through that if that's an option that you're interested in, to have that automated results reporting. So at this point, I'd actually like to pull up one of our microsites that will help you in terms of all of the things you need to do to be successful with the BD Veritor system. And one of those things is training, right? That's a very important component, making sure you have competency assessments and training, and what does that look like? So I'm just going to share the BD microsite that has been set up in regards to the HHS system, and to walk you through what you'll see here when you log in and access the microsite. So of course, you'll have many different tabs. You'll be able to get all of your information in one location, and you'll see you have the system overview. So if you forget some of these things that we're talking about today, of course, it's here on the website. You'll have all of those collateral pieces, those tools, those components you need for training and familiarization. We have a link to help you go through and set up training. We've got a great e-learning system, and to register for that, it's really easy to just click on the button here, register for training. And there's, many resources to help you get on this. I really like the e-learning platform. It's great because it allows you to not only take trainings, but there are competency assessments and different things in there that you can play around with, and you have control to set whatever you want, your facility, your staff, your location, what you want them trained on, what you don't, what competency assessment, what that looks like for you. So that really gives you a nice tool to do that training. We've got educational resources. I mentioned some of these, of course, anything from, questions on EUA or questions on CLIA waiver, all these nice fact sheets and nursing home data. You can see all of these links in one nice place. So you can have a one-stop shop. Support, always important. If you forget, where do I go? How do I get help? It's here. Just go on the microsite. You can see how you can connect in to BD to get that support. We also have a function on ordering tests. I know that question has popped up before too, so you can simply click on that site and you will have information that helps you right there to get reordering of those tests. So always like to point you to this microsite, this worldwide website that can help you with everything in one place. And back to, just specifically walking through some of these things, the e-learning platform really is great. Again, you can get that link right through the microsite. It's a nice system that's helped set up, gives you the control to be successful for your training, onboarding, competency assessment. We talked a little bit already about continued support, through the microsite, but also through BD's one-on-one white glove experience, right? So through your account executives and through the ability to offer you support with training, setup, go live, whatever that looks like for you. The batching workflow, the connectivity piece, all those questions that pop up. So making sure that BD is there for you to ensure that you have the support you need to be successful. And again, our approach to implementation, this is really about customizing and providing you the support you need, understanding what those needs are, developing a plan, obviously this customized plan, if that's to help you with your go live or support, helping you with those trainings. Obviously we showed you the microsite and competency, and knowing that you have the ongoing support of BD. So I believe those are all the slides I have, and we want to leave time for Q&A. Hopefully didn't run over there. So guess we'll pause and do Q&A. And we see we have David back, which is awesome.
Courtney, just really quick, somebody was asking, they said that the text was a little bit small on that site. So it is simply bdveritor.com. And then if you go over to the, there was a link for the long-term care facilities.
Oh, the microsite? Sorry, pull that up again. I know I had it open. Let's see here. Yeah, it was small. I agree. You can zoom in here.
There it is. It's the get started. So if you go to bdveritor.com and then over under the get started section is where it will take you to the long-term care facilities. And then all of those other resources that she was showing are under there.
Great. Yeah, you can't zoom in on the little text bar, but you can zoom in on the website. So bdveritor.com, and then it will have that long-term care facilities line. Perfect. Thanks, David.
Yep.
All right.
Thank you. Thank you so much, Courtney and David. That was really great. We have time for just a few questions, and again, we will address all of your questions after today's webinar as well. So a few questions came in about proper disposal of cartridges. So what is the proper way to dispose of cartridges?
Yeah, so proper disposal would be biohazard. Again, any way you would treat medical waste, you would treat the cartridge, right? So the cartridge, the nasal swab, the components, the reagent vial, those are the only three components. Those would all go into biohazard. However, your local regulation has you dispose of biohazard waste.
Great. A question in relation to batch testing. Once the sample is collected, how long is the specimen viable for testing? And along those same lines, how long is a swab good for before testing?
Definitely. So if you look at our package insert, the IFU right now, we have 1 hour. So 1 hour once you collect the swab, again, to run that swab. And then once you have inoculated your reagent vial, which is that way you can kind of easily transport things in the closed system, that's 30 minutes. So you remember 1 hour for the swab and then 30 minutes for the reagent vial.
Great. Can you run flu and SARS-CoV-2 with the same specimen and or simultaneously?
Yeah, that's a good question too. So right now, given the urgency with the EUA, right, we have the SARS-CoV-2 test on the market and we have our flu AB test on the market. So right now, those are two separate tests. Obviously, BD is working on a combined test, and it is ideal to have one specimen, right, with one reagent vial that could go into both tests. So for now, we have the two separate tests that are on the market. So you'd have your flu AB and you'd have your SARS-CoV-2.
But also just to chime in on that and clarify. So if you're looking at the same patient, so if you're trying to do a flu and a SARS-CoV-2, you would just collect the specimen from the patient and run two different tests. So just to clarify.
Thanks, David. Yep.
And they can be run one right after the other and popped right into the reader right after the other.
Of course, yeah. You could choose to run them in batch mode, right? You could run your SARS-CoV-2 first because it takes 15 minutes. Then you could start that flu AB from the same patient, and then you could get those test results back to back really quickly. So like David said, collect the patient specimen, but then you would run those two tests until we have a combined test, right? Then you'll have the beauty of everything on one cartridge. So.
Great. And last question, given that the Veritor can only complete 3,500 tests How do we know when we have completed 3,500 tests?
Yeah, definitely. So there's a couple different ways. So the actual instrument itself, it will start telling you when you're getting close to that 3,500 tests. It will count down. So when you turn it on, you'll begin to see those notifications starting when you have about 300 tests left. So that's a way. There are also a couple other ways. There's a way you can check how many tests you have, and that's in the IFU. It gives you an idea of how to do that. So that's helpful. If you are downloading the data, printing the data, sending it through the Synapsys automated results, all of those ways also will be telling you the number of tests you're on each time. So you'll have that record. So again, there's ways to, you'll get notifications, and you can also check when you're, have your results reporting. It will be telling you, this is test number 3,200. So you'll have that record.
Great. And last question, do you clean the machine between cassettes, and what is the best mechanism to clean between cassettes?
Yeah, so cleaning, again, that is up to the individual site, whatever protocol you have in place, how often you need to clean. BD doesn't specify how often you need to clean, right? That's your choice. It depends on how often you're running, what your workflow looks like. When you do decide you want to clean the instrument, again, it's where you lightly moisten that towel with either 70% isopropyl alcohol or a 10% bleach solution. So either of those ways, which hopefully are things you would have on site anyways for cleaning, both of those solutions can be used to wipe down, the instrument. So up to you how often, but that's the way that you can clean the instrument.
Courtney, I just want to jump in really quick, just because there are a lot of questions, and I want to make sure that everybody walks away with a clear understanding. Going back to the number of tests on the instrument, a lot of people are asking about what happens with that, and what do they do afterward. So, that the limited life on that instrument, again, is designed to make it as simple as possible, so there are no calibrations and no maintenance that's required. After that 3,500 tests, that instrument can be discarded with medical waste, electronic medical waste, whatever you have, and then you will need to get a new reader. Now, with the intent that we have, again, of simplicity, we've kept the price very, very low on those readers, but we've also gone the extra step of providing a flu combo kit. So our customers are able to order a particular SKU through their distributor that gets them 2 flu kits and a reader for the price of the 2 flu kits. So it's basically buy 2 kits, get a reader for free. So we do have mechanisms where we're able to provide no charge readers to our customers. But even if they're only doing the SARS-CoV-2 test, the cost of the reader is low enough that it does not add a significant additional cost to the price of running a test.
Great. Thank you, David. I know we are running very, very tight on time, so I'd like to turn it over to Jean at CMS to discuss the nursing home testing rules update. Thank you so much, Courtney and David. Jean, you may be muted.
Okay, how's that?
Perfect.
Okay, wonderful, thanks. And thanks for having me on to talk today, and for all of you for joining, and the many questions that I see coming into the Q&A box. So I wanted to just give a brief overview of the interim final rule of comment that we released on August 25th, as well as a number of the guidance documents that accompany that rule. And overall, if you've had the opportunity to review it, you'll note that the primary theme of the new regulation is really to significantly increase the reporting of testing results and other COVID-19 data elements from laboratories, nursing homes, hospitals, and other clinical care sites, as well as increase the testing of nursing home residents and the staff. So it's the actual testing and the reporting that we focus on. There are other provisions in the interim final rule that I won't touch on today, but I do encourage you to take a look at the entire rule. As for example, there's even information about the SNF value-based purchasing program in there that you would probably find of interest. So while we've provided guidance on in the past on testing of both residents and staff and a number of different documents related to infection control, reopening, etc., in the nursing home requirements, but this rule specifically requires testing for the nursing home staff and residents based on specific requirements and parameters that the rule says as defined by the secretary. And so in support of the rule on I believe it was the 26th, we released guidance that provides the detail for how to meet the new testing requirements that were developed in close collaboration. CMS worked with CDC, we worked with OASH, our sponsors for this call, and many others to try and get you the most up-to-date and accurate guidance that we can. And also, as we learn more, we continue to update it. So there are a number of avenues for you to stay connected as guidance changes. So specifically, the guideline includes information on prioritizing individuals to be tested. And we note that nursing homes should first prioritize, and it probably goes without saying, but those that have symptoms. And so whether that be residents or staff, those with symptoms would be a priority. And then the next priority would be in an outbreak situation. And we've defined an outbreak as one new case in a prior COVID-free facility, then in an effort to stay ahead and keep on top of the outbreaks. I think we've all seen that things can go quickly from COVID-free and to facilities with a number of cases. And so we're all working to try and keep that spread to a minimum. So once you prioritize the symptomatic patients, the outbreak patients, we've also provided recommendations for what we will call routine testing, but it's based on the extent of the virus in the community. So it's not just random testing. There are some there are guidelines that go along with this. And so as you would look at the county positivity rate for the prior week or 2 weeks, but prior week, look to see what's in other words, look to see what's happening in your community. And that would trigger whether you need to go into your routine testing mode. So we are providing county positivity rates. They can be found on our nursing home site, cmsdata.gov, that we're getting from you as it's reported to the local health departments or state. We then get that data from the CDC and we're posting it on our site. And it will show what that rate was for the week. Now, you may, since we're getting from you, you may get the positivity rate for your particular county even sooner. So working together, we should all be getting good information. But if the rate is low, which we've determined to be less than 5%, then the minimum testing frequency would be once a month. If it's medium, 5% to 10%, then that would be once a week. This is for staff, and this is to prevent getting the virus into the nursing home. And if it's high, if there's a community prevalence rate of greater than 10%, and there are some counties that are still greater than 10%, then at the current time, that would be twice a week. Now, again, this is one piece of data. State and local officials may also direct you to look at other data to monitor, such as the emergency department visits or hospital occupancy rate, ICU occupancy rates. There are any other number of factors that you might want to consider, but at a minimum, we're asking you to look at this county positivity rate. Because this is a regulation, it's a part of the conditions of participation. Facilities that do not comply with the testing requirements will be cited for non-compliance at a condition level. And so what that means is it would fall under the enforcement remedies as stated in our state operations manual in Chapter 7, which most people are very familiar with. So we would go through the process. It could mean civil monetary penalties or other enforcement remedies. Now, obviously, we recognize the challenges that sometimes exist in certain areas when trying to perform this routine testing. And when a facility is unsuccessful in meeting these guidelines, our surveyors will be looking for this, but they will also consider documentation that you have that would support that meeting the requirement has been a challenge, such as you don't have the access to the testing yet, or you are unable to get testing results within 48 hours. Much longer than that would kind of defeat the purpose of the regulation. So, but all of that would have to be documented, and we would take that into consideration as we are looking at whether a best attempt was made to meet these testing guidelines. And obviously, the point of this is not to be looking at regulations, it's to protect the residents and the families and the staff that want to get back to being able to see their loved ones, or knowing that the facilities are COVID-free or to the extent possible contained. And so that's what the bottom line is in all of this. So working together, I think that we can certainly achieve this. One last thing, I wanted to also mention, I'm keeping my eye on time, that we also included that there's a reporting requirement with this, but this falls under the CLIA guidelines. And so I wanted to note that the CARES Act already required that all laboratories performing testing related to SARS-CoV-2 to report data daily for individuals that are testing. So you're doing the test, it should also be reported to the appropriate state and local public health departments. I think the prior presentation showed a number of ways to be able to get the data that's needed for reporting. And this does apply to anyone doing the testing, including nursing facilities. And of course, with the regulation, it would be subject to civil money penalties if, in fact, the testing requirements were not met during the period of time. Again, we have built in a grace period for this, for people to be able to get the test results, learn how to do this, and our surveys will be considering that. It's already been mentioned about the asymptomatic testing, and that the FDA has put out a FAQ that addresses this, and I encourage you to take a look at that. The link to that is in our guidance. And from a CMS perspective, we will temporarily exercise enforcement discretion for the duration of the COVID-19 public health emergency under CLIA for use of the point-of-care antigen test on asymptomatic individuals. Specifically, we will, because you're doing it under your CLIA certificate of waiver, we will follow what's in the FAQ from the FDA. So that I just would like to mention that. There are also within that rule hospital reporting requirements, as well as the fact that from a payment perspective, we had previous policy that allowed repeated COVID-19 testing for Medicare beneficiaries without physician oversight during the PHE, but the revised policy that was in this interim final rule clarifies that you can get the initial test without an order, but subsequent tests would need to be ordered by a treating physician or other healthcare practitioners. We are providing a number of training programs, one of which is a national training program, scenario-based, that we're asking all nursing homes to take. It's available. It's on our website. It's immediately accessible by over 1,500 Medicare, Medicaid certified nursing homes. It's what makes this particularly important is geared toward, at least many of the modules are geared toward frontline workers. We do have modules for management, staff, executives, but this has both for the frontline and the management. And we've already had many thousands that have signed up for this test. you have to pass it at 80%, and you will be acknowledged with a completion certificate once you do that. So I think I will stop there. We will be having an all-national nursing home call next week. I believe it will be Tuesday, but we will be getting all information out to you on that, where we can go kind of step by step through all of this, get more of your specific questions answered as you're trying to implement this. But so please look out for that invitation so that it will be a sufficient amount of time to walk through all of this information. So with that, Rachel, I will stop.
Thank you so much, Jean. And I am incredibly mindful of time, so I'll probably just give you 2 questions, and then again, we will try addressing all of the questions that have come into the Q&A box to address and send out to all the participants of the webinar after this. So Jean, a question for you. Oops, and I just lost my question. Okay. Do nursing homes need to report only positive tests when doing point of care testing, or do they need to report all testing that has been done to their public health department? And additionally, can you clarify that testing needs to be reported daily?
Yes, so the requirements for testing are in accordance with the guidelines that have been put out with the Department of Health and Human Services in a June 4th memo. And that does require daily testing, and it does outline kind of 18, I believe it's 18 or 19 requirements that are included that must be, and it is for all tests. Thank you.
Great. And Jean, you mentioned a grace period for nursing homes. Can you specify what that grace period is, or is that additional guidance that will come out from CMS?
Well, right now, what we're looking at is from the date of the rule, which was yesterday, I believe, 3 weeks grace. But then after that, we are looking at kind of getting a warning or a letter that says, look, this is what's required. And then after that, doing enforcement. So it could be up to 4 to 5 weeks, but we'll keep in touch with you as far as the exact number of weeks.
That's great. Thank you so much, Jean. Okay, I'm incredibly mindful of time and know that we are well over our scheduled time today, but I want to thank all of you for joining today's webinar. I found it incredibly helpful, and I hope you all did too. Again, we have recorded this webinar, and we will be sending it out to everyone after later this afternoon. We will also send the slides that both BD and Quidel presented to you all, and we will follow up later this week with questions that we were not able to address in the webinar. Also on the slides that will be sent out, there are email addresses that questions can be deferred to after today's webinar. So thank you all again. Thank you for all of the work you are doing. We greatly appreciate it. And you are, that's it. I hope you all have a wonderful holiday weekend. Hopefully you can take some time off, and thank you again.